Let's stay with health matters. Health stakeholders are now calling for concerted efforts to enhance the access of self-injectable contraceptives, citing the significant increase of their uptake in the country. According to the Insupply Health organization, the country has recorded a 19% increase in the consumption of the self-care family planning method since the year 2017. The uptake has been attributed to its discrete convenience and effectiveness.
As Kenya gears up to increase modern contraceptive prevalence from the current 58% to 64% by 2030, in line with its family planning 2030 global commitments, stakeholders in the health sector have highlighted the growth in popularity of self-care methods as a sustainable pathway to expanding access to family planning in the country.
When we began back in 2017, the uptake of self-injection was less than 1% in the country. But through the interventions we've had on capacity building, on enabling policy environment, on demand generation across the years, currently we are at about 20% of uptake for self-injection.
Now the self-injection offers women of reproductive age that choice. I can be able to inject in the confines of my home.
Speaking during the closeout of the Access Collaborative 3.0 project in Nairobi, the players led by the Insupply Health organization supplying chain manager Johnson Anyona specifically highlighted the increased uptake of DMPA-SC. The subcutaneous injectable contraceptive allows women to self-administer at home, giving them the freedom of choice and access.
This injectable, first of all, is administered subcutaneously. So the previous one that was there was the intramuscular one, but now this is a new method that comes that the client themselves can be able to administer at their own convenience.
To maintain the momentum, the players highlighted the importance of expanding access through channels such as private pharmacies and non-traditional service points.
The discreteness of it, the convenience of it, and also the fact that due to client retention, I'm able to still talk to my healthcare provider as I administer or if I see any untoward effects that I need to get reported. So it is a plus.
I'm calling upon also the retail pharmacy providers to take this on board to be able to offer additional expanded family planning services outside of the condoms and pills which they've typically done.
They also called on the national and county governments to increase funding for family planning services and especially innovative self-care solutions.
We are looking forward to work with our partners to get the trainings across the country so that the plan is not to convert women of reproductive age into self-injectors, but to provide them with a choice of whether they would want to go with the self-injection, the 3-month, or to have other methods as would be available in the health facilities.
John Kahiro, Prime Edition.